Hi, Lindsay. How are you today?
I'm not doing so great. I'm in a lot of pain today.
Okay, and I understand from your intake form that you're experiencing some, back pain, some pain kind of all over. Mm.
Yeah, it's in my neck is where it's starting, and then like I've got pain that comes down into my arms too, and I feel like everything's just hurting, and anything I do is just like really painful.
Do you know where this pain is coming from?
Yeah, so I got an MRI, and the doctor said that I've got degenerative disc disease, and so my neck is just breaking down, and it's causing all this pain.
So, did your doctor describe to you what degenerative disc disease is?
No, he just said that that's what I had based on my MRI, and that it just sounds like my neck is breaking down.
Okay, so degenerative disc disease, a lot of people live with it without any symptoms or with any pain, really. And it doesn't necessarily indicate that there's a ton of tissue damage happening at that site. So sometimes, they actually show like a lot of people do not show any symptoms. And so I'm going to talk to you a little bit about pain and what may be going on. Is it all right if I do that?
Yeah,
Okay, so are you familiar with neurons and like the nervous system?
a
Neurons?
little bit. I know that we have it.
So basically, these will represent some neurons. This is usually, this is the brain, okay? And so neurons go to the brain, and there's some processing. So there's input, processing, and some output of activity. So, when we say if you feel a nail, okay, under your foot, then that gets, it goes to the brain. The neurons send that signal to the brain, and the brain does some processing. And what usually happens when you feel a nail under your foot?
Hurts.
Yeah, it hurts. So there's a pain response, and usually there's, you remove your foot from that situation. And so, you know, usually when there's tissue damage, that pain is going to be pretty proportional to the signaling that's happening. So, um, when in situations, sometimes there can be really low stimulus, something like more like a stick, okay, something that's not really that sharp. So it shouldn't really, you know, bring on too much um, of a stimulus to the brain. So it should be pretty much a response of, ow, there's a stick under my foot. Let me just move that away, okay? But sometimes the brain, in its processing, will have a response that is in high pain for something that is not necessarily something that's damaging the bottom of your foot. And so, how does that happen? How do you, there can be so many different factors beyond just what's happening at the body or from the environment. And it could be things that are coming from other sources. And so I understand that you're kind of experiencing some stress in certain parts of your life. Is that
Yeah,
right?
I can't keep a job because my pain is just so great. I have to skip work and everything. I just can't keep a job because of that.
Yeah. So sometimes like factors that go into, experiencing the pain response has to do with other factors in home life, in things like your job, um, things like, social issues with, family members, things like that. If a death in the family, they show that that happens a lot. And so have you had any resources that can address these stresses in your life?
No, I haven't.
No? Okay, so we'll go ahead and try to maybe help you with that and get some resources along with doing what we can in physical therapy to kind of address the pain that you're experiencing now. Okay?
Okay.
Is that all right?
Yeah.
Okay.